Mr. Thompson, you're recognized.
Thank you, Mr. Chairman. Thank you for calling today's hearing, and I want to thank the witnesses for being here today. Although I think it's ironic that we're holding a hearing today on long-term care facilities while the House Republicans are in the process of cutting $880 billion from Medicaid. 63% of all long-term care patients rely on Medicaid coverage to pay for their care. These cuts to Medicaid will hurt 26 long-term care facilities in my district, which provides services for 8,000 patients, half of whom rely on Medicaid. And it's not just patients who will suffer from these cuts. Long-term care facilities support 8,500 jobs, pay $548 million in salary, and contribute $183 million in federal and state taxes. As soon as the Republican budget was announced, I met with healthcare professionals in each of the 5 counties that I represent. What they told me should concern everyone on this dais and every American. They said that the Medicaid cuts in the Republican budget would hurt people on Medicaid and also veterans, people on Medicare, and people with private insurance. These drastic Medicaid cuts will mean 54,000 fewer people will be covered by Medicaid or CHIP, also known as the Children's Health Initiative Program in California. Rural hospital closures will lead to longer drive times and more preventable deaths in emergency cases. The large hospitals that are able to stay open will cut specialists, leading to fewer local treatment options for Medicaid recipients as well as people with private insurance. I also heard that larger systems will pull back on support for long-term assistance and programs to help keep people in their homes. Without Medicaid-funded equipment, some people with disabilities will be unable to get out of bed and go to work. Some will not be able to stay in their homes, which will mean a higher cost to taxpayers. These Republican Medicaid cuts would cause a $2 billion reduction in economic activity in my district alone. That hurts Main Street. Mr. Chairman, I know that members on this dais will object and say that Medicaid and Medicare and Social Security aren't mentioned once in the Republican budget, but as you know, you can't cut $880 billion without touching those programs. And along those lines, I'd like unanimous consent to enter into the record this news article where Mr. Musk is talking about going after and cutting Social Security. And these are all life-saving programs, and they're being dismantled. The health and the economic impacts are going to be felt in every congressional district and by every American.